Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
A familiar furry face asked a seemingly simple question on social media, and we answered. Sesame Street's Elmo checking in to ask how everybody's doing. It's a tweet that was met with an outpouring of exhausted responses. Now, this week's Healthier Together isn't all about Elmo, but it is about what he started, a conversation, and the obvious need for us to have a caring, understanding ear when talking about mental health.
Why is it so hard to talk about? Number one, we don't talk about it. And number two, the way that we talk about it. That's what makes it hard.
Dr. Keith Dempsey is a clinician, speaker, and community advocate.
Anytime you don't talk about something, no matter what it is, it gives it a kind of stigma. It makes it taboo. So whatever that thing is, really what that says is, whatever that thing is, it's not okay to talk about. There's something wrong with that thing.
And historically, when we talk about mental health, the way we approach it has been negative.
We talk about it like if you're dealing with mental health, something is wrong with you. So now that I've been, going around the country for this past year talking about this stuff, I just say, you know what? Mental health is a human experience. It is a human experience. We all have it.
February 1st is Time to Talk Day, a growing movement to encourage everyone to start a conversation about mental health. It can be as simple as checking in. How are you doing? And Dr. Dempsey says the most important thing that you can do for others is listen.
It doesn't have to go any further than that. Hey, I'm here to talk. I'm here to listen. I'm not trying to judge. I don't have answers for you, but I notice, that, things have been a little hard for you, but I'm here.
Now, the challenges with starting the conversation and accessing care are unique to everyone. And Dr. Dempsey is trying to address that in the Black community.
There's a lot of stigma. There's we don't go to counseling, we go to church. What goes on in this home stays in this home. So there's a big push. Everybody says, Black folks, we have got to get past this stigma. That's correct. However, it's incumbent upon us to understand where that stigma came from. There's a history in the medical systems, there's a history in the mental health systems that African American folks have not been treated well. So when you haven't been treated well and you haven't gotten good outcomes, you are in a place that's not safe, you stay away from those places. So the first thing is to understand that the stigma comes from somewhere.
And that's why it's so important to talk about it within our families, our friendships, and our communities to build trust, break stigmas, and foster better mental well-being. In next week's Healthier Together, Dr. Dempsey goes deeper into the barriers Black communities face when talking about mental health and access to the right care. For more resources, go to kgw.com/healthiertogether. And remember, if you or someone you know is in crisis, help is available 24/7 by calling or texting 988.